this video, we're going to be talking about the anatomy of the muscles of the forearm, especially the posterior compartment. The anterior compartment will be later discussed in a different video. When you think about the posterior compartment, think they're mainly for extension. Anterior compartment, on the other hand, is for flexion. Now, there's a superficial group as well as a deep layer or a deep group. Superficial group include brachioradialis muscle, extensor carpi longus. Longus stands for long tendon. So in case when you're in your anatomy lab or in your dissection hall or you're looking at an anatomy model, if you see a long tendon, think it's the longest version. So therefore there must be also extensor carpi brevis, which means a short tendon, extensor digitorum muscle, as well as extensor carpi ulnaris and extensor digiti minimi, and last but not least anconeus. So in front of you we have an image, the anterior view or the superficial group. Where the mouse is pointing now represents brachioradialis. So in this image, brachioradialis is where the mouse is pointing to now. The next one down would be extensor carpi longus, because you can follow it down with a long tendon. Extensor carpi brevis is not shown here. This one here is extensor digitorum muscles, because you can see the tendon going to the digits, i.e. the different digits. The next one down is extensor carpi ulnaris, and the next one is extensor digiti minimi, because it goes to the little finger digit or the minimi, and this one here is anconeus. Let's pause the video if you didn't understand. Now we're going to go and look into the superficial group of the posterior compartment, the 3D anatomy model. This is provided by Complete Anatomy of 3D Model. You can download it off the MacBook App Store or even the Play Store. So now we have the superficial group is represented here. So all of these muscles here, which is highlighted in orange, is represented as a superficial group. Now those superficial group include the brachioradialis, which is the biggest muscle. So you can see here, so even though you might think it forms the anterior compartment, it actually is part of the posterior compartment. Then you have, according to our classification, we have extensor carpi longus muscle, extensor carpi radialis longus, because it is a long tendon. Then the next one next to it should be extensor carpi radialis brevis. The one next to that, the big one, is extensor digitorum. Like we said, it goes and the tendons attach onto all the different digits. And the one next to it is extensor carpi ulnaris. The way to think about it is on the ulnar side of your bone. Extensor carpi longus radialis is on the radial side of the bone. And so these are the muscles of the posterior compartment, so as highlighted in orange. Talk about the superficial group of the posterior compartment. So you just saw all of them conceptualized in one video in the 3D anatomy model, and we will explode them and break them down in the coming few minutes. The first muscle will include brachioradialis. Now, then extensor carpi longus radius, extensor carpi brevis radius, extensor digitorum, extensor carpi ulnaris, extensor digiti minimi, and there was one which I have not included in the video or is not shown on the screen now, so that you can get you thinking, and that was anconeus. Brachioradialis originates from the supracondylar ridge of the humerus and inserts into the distal part of the radius, and is supplied by the radial nerve. Extensor carpi longus was originating on the supracondylar ridge of the humerus, and again, but this time inserts in the second metacarpal bone. So the origins for brachioradialis, extensor carpi longus are pretty much the same, but the insertions are different. And again, innervated by radial nerve. Extensor carpi brevis, on the other hand, is on the lateral epicondyle. So remember, think again. Brachioradialis and extensor carpi was supracondylar. This is epicondyle, and it inserts in the dorsal aspect of the base of the third metacarpal bone, again innervated by the radial nerve. Extensor digitorum, on the other hand, is again the same as extensor carpi brevis, lateral epicondyle of the humerus, and inserts in the dorsal parts of all the distant phalanges, so the different digits or the little fingers. You can pause the video likewise and memorize this by heart. But the way I tend to remember it as an anatomist is simply, I don't go into too much detail. I know that these muscles originate from the humerus, some part of the humerus near the end or the lateral 2/3, and then they go on to subsequently insert into the different parts of their function. It's innervated. The extensor digitorum is innervated by the posterior brachioradialis. Brachioradialis inserts into the, so we can see it starts off how I remember is supracondylar ridge of the humerus and inserts into the radial bone, or the distal part of the radial bone. Its nerve supply is the radial nerve, and artery supply gives off the radial recurrent artery or radial collateral artery, because think the radial recurrent artery would be somewhere here, as well as the radial recurrent artery will be somewhere here. Now the next muscle in the posterior compartment of the superficial group include the longus, because you can see it as a long tendon, and this is now again in the supracondylar ridge, but inserts in the second metacarpal bone. Next one down, we have the extensor carpi brevis. So the longus was previous, and brevis now. Again, starts off this time from the lateral epicondyle, and inserts into the dorsal aspect of the third metacarpal bone. Again, innervated by the radial nerve and also the posterior interosseous nerve. And the arterial supply is the radial recurrent artery, like always. Then we have the extensor digitorum. The extensor digitorum is the easiest one to recognize in the anatomy lab, because it goes in when you pull back or contract on this muscle, it will lift, it will extend, cause extension of the fingers or the palm. Now they originate from the lateral epicondyle and again inserts into different digits, supplied by the posterior antebrachial interosseous nerve this time, and the arterial supply include the radial recurrent and posterior interosseous artery. And last but not least, we have extensor carpi ulnaris muscle. This goes on to innervate. The main job of this is to basically, you should need to know that it attaches onto the ulnar side. So you can see it starts off again in the lateral epicondyle region and then inserts into the fifth metacarpal bone. So you can see the fifth metacarpal bone here. That pretty much sums up most of the extensor digiti minimi, which is one I left out. So you can see extensor digiti minimi is going down as a long tendon and goes into the last and the fifth finger. That's how I tend to remember it. Now the deep group of the posterior compartment. So the posterior compartment includes various different muscles. Now the main thing I want you to know is the arterial supply is always the anterior and the posterior interosseous artery, whereas in the superficial group it was mainly the radial recurrent or the collateral recurrent artery. Nerve supply here is also posterior interosseous nerve, but also in the superficial anterior compartment there was also accompanied radial nerve innervations as well, alongside posterior interosseous nerve. Muscles include supinator, main function is supination of the arm. Next one was abductor pollicis longus. Now, supinator originates in the lateral epicondyle of the humerus and inserts into the posterior aspects of the third of the radius. You don't really need to know exactly the origin and insertion, as long as you can identify the muscle, and you are good to go. Abductor pollicis longus, on the other hand, is abduction. It causes abduction. Pollicis in Latin means thumb, longus meaning long tendon. So if you see a muscle in the posterior compartment, i.e. in the extension side of things, but it does an abduction function, you need to understand what an abduction is. It's a movement. Extension is movement backwards, abduction is away. Abduction and adhesion are, they're contralateral words. The origin of the abductor pollicis longus starts off in the ulna and then inserts into the base of the first metacarpal bone. It's better when you visualize it later on in this video. The next muscle is extensor pollicis brevis. Now this is function is extension, extensor pollicis longus, and last but not least, extensor indicis. Let's go and have a look at the 3D model of how they look like on screen. The deep posterior compartment of the forearm muscles. So before we do that, let's just have a quick quiz. Highlighted on the screen now is brachioradialis, then extensor carpi radialis longus, because you can see the long tendon. This one here, since it goes to all the digits, should be extensor digitorum. This one here think it is on the ulnar side, so it's extensor carpi ulnaris. Now, what you might be thinking, why does extensor carpi ulnaris have as longus and brevis, but it doesn't? It's just that extensor carpi ulnaris only has extensor carpi ulnaris. That's it. There's no longus or brevis. Flexor carpi ulnaris has longus and brevis, which we will touch in the next video. This muscle here would be extensor carpi brevis because of the short tendon. When you have a long tendon, it's longus. Now let's remove these muscles. So these are superficial, like we said. So when we get rid of these muscles and we expose the more deeper side of things, we tend to see in the posterior compartment there aren't as much muscles. This one here is the highlighted now, since it goes down to the digit, is known as the extensor digiti minimi. And once again, extensor carpi ulnaris. So now we're left with a certain bunch of muscles. Here, this would be again extensor, not flexor carpi ulnaris, so we're not going to touch on that. So the posterior compartment now, the one muscle that I said in the video previously as well that I left for you to understand was anconeus. It does have a bit of action. It extends the forearm at elbow joint, but it's not so prominent. Now this muscle here is a supinator. It originates in the lateral epicondyle, so you can see it originates in the lateral epicondyle and inserts directly into the upper part of the radius itself. Then we have what's known as the abductor pollicis longus. Now why is longus? Because a very long tendon, you can see, and it goes pollicis, I told you earlier, it was thumb in Latin, so it attaches a thumb. So if you see a long tendon, which is right next to, above this would be in extensor carpi or brachioradialis, just think that it is abductor pollicis longus. You can get it confused between the next one, which is extensor pollicis brevis. Abductor pollicis longus is a bigger muscle, and if you pull on the muscle and you can move the thumb, abduct the thumb, then it's abductor pollicis longus. Now extensor brevi, pollicis brevi again attaches the thumb, but it's brevis this time. It originates in the posterior surface of the radius and inserts into the base of the thumb. Nerve supply, all of these are supplied, like I said in the PowerPoint, by the posterior interosseous nerve and the arterial supply of the posterior and posterior interosseous artery. This one here again, try name it yourself, since it goes to the thumb again, but with a very long tendon. Again, it's at the back side, so it's extension, so it'll be extensor pollicis longus. Then we have indices, right? Extensor indices, because it goes to the index finger. So that sums up the muscles of the forearm. The main rule is the arterial supply of the deep part is done by the anterior and posterior interosseous artery in general, as well as the nerve supplies from the posterior anterobrachial interosseous nerve, which is a branch of the C7 to C8. So thank you for watching the video. Next video will be the anterior compartment.